Thursday, believe it or not, 2 weeks to go until Christmas. Today, 2 weeks to go.
We got to get going.
I'm telling you,
It's flying by.
Isn't it?
It is
Are you ready,
by. It's
Dr.
crazy.
Cherny?
Dr.
Are you
Eugene
prepared?
Cherny
Are
here
you
with us.
ready?
No way. No way.
Now, question I have for you before we get to the topics at hand.
Okay.
Christmas time rolls around. Do people come into your office and they say, hey, listen, I want to get my wife something special for Christmas. I want to surprise her. Can you do something?
It'd be a family where they've been talking about somebody doing plastic surgery, and they've been thinking about it for a long time. And you know, usually like the mom is, you know, not sure. She feels bad about spending the money or something like that, and can't quite decide. And then the husband says, I want you to have this. I want you to be happy. And they'll go in and they'll prepay for breast implants or for a tummy tuck, or, you know, it's usually a mommy makeover.
I can imagine
like
what the gift card looks like for a breast implant. That would be amazing.
But is that pretty normal, even if you're not thinking that bad? But, you know, as you showed right here on the show, like Botox or, you know, a filler or anything like that. Not such a big procedure, but is that pretty normal?
Some people buy a few people buy these big things, but then there's always a lot more people that buy, they'll buy like a gift certificate for Botox or for, these facials that my esthetician Stephanie does. They are so nice.
I've heard about those. They're wonderful.
People kill to have those facials, and so we give a lot of those as gift cards and stuff.
So just stop into the office and you can get those there? Yeah,
or we can just mail it to you.
Don't feel weird about going in and asking for something like that, because it is very normal to do things like that, and women would love it.
Actually, we love doing that, because then it's got that great pleasure of being gifted. It's people like it more.
Well, good. But you know what? We're talking about plastic surgery here, but what are some good qualifications when you're talking about plastic surgery? Somebody that would be a good candidate for you?
Well, someone that's a good candidate generally has to be someone who's in good health. We don't want to operate on somebody who's like on the transplant list. So generally, our patients are very healthy, and that makes our statistics for, you know, adverse events like really great. We really have very few people that have, you know, problems during surgery, because you tend to select out someone that isn't going to. And so then the people that, you know, do well for aesthetic surgery, you know, what we've noticed that people who are athletic, they recover like bam. It's like bam, they recover so fast, it's crazy. If you're in good shape, and this has actually been discussed not just in my specialty, it's in the New England Journal of Medicine last year even, that if you are athletic, you just do so better after all kinds of procedures. And the same thing, you know, would apply for, let's say, you know, you got sick and you needed, say, chemotherapy or something like that. The more athletic and healthy you are, you know, the tougher you are to take it. So that makes somebody a good candidate. And then sometimes, you know, with exceptions, generally speaking, if you're not overweight, that also means you're healthier. I mean, and I'm talking about a body mass index of 30. I mean, I don't expect everybody to be skinny, but people turn out better the lighter they are, the better it looks, and then they also have a faster recovery too. So that's good. But body mass index of 30 is pretty liberal, I think. I'm one of the more liberal plastic surgeons in the city.
Well, it's because as we've discussed with your practice before, not anyone's just coming in and be like, hey man, I just really don't like how I look. It's like, if you've done the process and you've done the work of going to the gym, but still just have some areas that need a little help, that's where you come in. You're not just saying, hey, come in, anybody come in and I'll take care of you. You really have a purpose for what you do.
These types of procedures are really not a substitute for, you know, a healthy lifestyle. So that is like so much better. And, you know, we have actually a diet plan, believe it or not, so people can lose weight before their surgery if they want. You know, with a dietitian, I have a nurse practitioner that leads you through this program for a few months.
I was going to ask you, how much ahead of time do you suggest?
Well, you know, if I can, I'd like to get patients down to that certain weight that we calculate by body mass index, because statistically that's where it's safe to do the surgery and you have fewer complications. See, so we do it until they get down to like a good weight, good fighting weight. You know.
There you go. But you're willing to work with them. That's wonderful.
Is there any plastic surgery that's covered by insurance?
You know, actually, a lot of it is, and actually, if you look around the world and around the United States, more of what we do is covered by insurance, probably because I spend a whole day just doing reconstructive surgery, and that means breast reduction. When people have really heavy breasts and it's causing them back pain, we definitely go to the insurance company, and if they meet criteria, that's an insurance case.
Now, how does somebody find out whether or not their insurance company will cover that? Will they come to you? Will you inquire for them, or do they go to the HR person, or what do they do?
Sometimes they have to, but my thoughts is that I wouldn't send my worst enemy to the insurance company to deal with them. So I hire somebody just who has,
so somebody can come into you and say,
iron stomach, who can deal with that.
So somebody can come into you and say, okay, Dr. Cherny here, here's my insurance card. Find out if I'm covered, and you guys will do all the legwork.
Oh, totally. What we do is, what they do a consultation with me, and then, I'll send them to my scheduling office, and they'll see what's going on with that.
Oh, that's a good.
So that's all. Yeah, that's all handled up front. We handle it for you because I think it's miserable to deal with the insurance company, because they, the stuff that they tell you half the time isn't even true anyway. So.
But you have an expert for that.
I got an expert for that.
Got it.
Wonderful. Now, something that boggled my mind, because I had to have reconstructive surgery on my nose when I broke it horribly, and you probably experienced this as well when you go into a plastic surgeon. They do it right there in the office. Like, not literally in the office, but there's a room in there in the office as opposed to going to a hospital where many people think of surgical procedures. Is that normal?
I think that's actually fun. We actually regulate these very, very tightly. You can go in and do it just in a room if you're doing something under local anesthesia. If you want to do, however, intravenous sedation anesthesia, and if you want to do general anesthesia like I do, I had to buy all this stuff. I had to go through this big, I had to go through this huge process. But my operating room is accredited. And
so you can do that at your place?
Yeah.
So you do have a big building there.
Yeah. It is a big building, and so it has a lot to heat. Oh my God! But anyway,
not this weekend, though, so you're fine there.
Yes,
okay,
better. Yeah. So it's all about being accredited, because that means it meets certain minimal criteria for safety and that kind of thing. So if you're doing something bigger than local anesthesia, you really need to go to a surgery center probably that is accredited.
And that's an important thing to look for. If you are having work done, you can't just go to anybody.
Oh no, you shouldn't go to anybody. It's not a long trip from there to the case of the. Oh, there was this guy in Florida that did like an arm tuck in the kitchen, and he was throwing the fat into the garbage can with the kitchen scraps. And so that's not that far of a trip.
Wow.
Goodness.
So you gotta. I know we hate these regulators, but we have to put up with them, and it does give us.
For that reason.
Well, yeah, but it gives us the street cred that it's safe to do the surgery with us.
Wonderful.
That's good. No,
So
somebody wants to stop by in 2 weeks. Before Christmas.
Well,
2 weeks for Christmas for the person who has everything.
How long are you guys open? Or do you close for the holidays, I would assume? But when's the last time we can come in and get a gift card for a procedure?
Christmas Eve.
Really?
Christmas Eve. I think we're open. I think we might be open just half a day. I guess I'm getting soft in my old age, but I think we're at least open.
But
in the morning.
It's not out of the ordinary for somebody to come in and get a procedure as a gift card.
Oh, yeah. I'll be lucky if I get my shopping done on Christmas Eve. So, yeah, it's not unusual at all.
No, I'll pick you up. We'll go shop together, because that's probably when I'll do mine, too.
Cool, Lou. It's a deal.
Twins out there shopping.
The best shopping time.
I need that shopping time.
All right, wonderful. Well, good job, man. Thank you so much for coming in.
It's great to be here, and and the holidays are coming up, and I want to wish everybody out there a very Merry Christmas and a wonderful holiday.
Yay!
It's over on Hickman Heartland Plastic Surgeries. Check them out right near Living History Farms down the street.
Thanks, you guys.
You have a good holiday.
All right,
9 minutes before 8 o'clock. We'll be right back. This is